Hi, this is Terry from HM Local TV, and today we're going to be discussing the topic of how to find a great orthopedic surgeon. Our guest today is Dr. Gloria Beim. She serves the areas of Gunnison, Telluride, and Crested Butte in the southern part of Colorado. Dr. Beim, welcome.
Thank you.
How are you today? Okay, so Dr. Biem, as people are searching for a great orthopedic surgeon, what kind of things, particularly when they're searching online, what kind of things would they look for to assure that they're finding a great practice?
Well, I think there's several things that you can look for. First of all, somebody who's been in the area for a little while, so they have some experience and they've been out of training for a bit. I think where they were educated is important. There's a lot of excellent medical schools and residency programs in the country that kind of stand apart from other programs, so it's good to see if they came from a reputable university program, for instance. I think usually puts out great orthopedic surgeons. And also, depending on what kind of problem you're seeking orthopedic surgeon for, is if they have specialty training. So the way it works is after 4 years of medical school, if you choose to become an orthopedic surgeon, you go to a residency program for 5 years, and then some people choose to just go into practice, and other people choose to do a specialty training or a fellowship. So for instance, I did a sports medicine, knee, and shoulder fellowship. So if you had a problem with your shoulder or your knee, you might want to try to find somebody like me who has had extra specialty training in those areas, because they'll just probably be more state-of-the-art and doing more of the cutting-edge techniques that are available today versus what were not available when they went through training.
Great. Okay. And so if they look on their website or that type of thing, are there clues in there that maybe can kind of help them to determine, you know, just if they're finding the right person? What would they look at?
Well, again, look at, generally on a website, the doctor will have a resume or a curriculum vitae attached to the website, so you can see where did they train, did they do specialty training afterwards, do they take care of any teams, for instance. If you are looking for a sports medicine specialist, it's often good to find someone who's involved with the local high school football or wrestling teams, or do they take care of Olympic athletes or professional athletes. Now, you don't have to find an orthopedist who takes care of Olympic and professional athletes. That doesn't mean that they are, you know, going to be necessarily a better doctor than somebody who doesn't. But I think even docs who take care of, you know, local teams, they just kind of stay up to date with the cutting-edge techniques for sports medicine. So that's another thing I would look for. Also, sometimes you'll have testimonials on their websites of just common people who have been treated, or sometimes on the websites are connected to profiles where they have had surveys and see how popular those physicians were. Because one of the things that I've found is you might look really good on a website, but is the doctor really going to spend the time with you that is deserved? And that's one thing that I am always really picky about, is how much time does a doctor actually spend with you? So for instance, the website might look great, great training, you know, associated with a professional ball team, whatever, but then you get into the office, you get 2 minutes with the doc, and they're in and out, and you don't even know what happened. They didn't explain anything, they didn't educate you. So I think it's really important to find somebody who spends the time, looks you in the eye, and listens, because that's very important when you're trying to get a diagnosis, is that the doctor listens to you. I always tell patients that 80% of the diagnoses can be made just on the history alone. So if you listen to the patient, often you can get a diagnosis even before you examine them. So sometimes you're not going to find that out just from a website. You might have to ask people who may have seen that doctor, or you may have to just go and try it out for yourself and see.
Okay, those are some good points. I think you're right. You can see a lot, you know, about a doctor online, but really the proof is once you get in front of them and you get that gut feel, I believe. So on if they're paying attention. So
That's correct. So there's three really important things when you're seeing a doctor. Number one is they listen. Eye contact, you listen to the patient, you hear their story, you ask the proper questions to try to get answers to figure out the diagnosis. That's number one. Number two is a good physical exam. Unfortunately, often these days you'll go see a doctor, you say, I hurt my knee, and they write a prescription for an MRI and say, okay, go get an MRI. They never even touch you. That's not okay, because you know what? MRIs are not perfect. They miss stuff. And sometimes you don't need, or often you don't need an MRI. You just need a good physical exam. So if you see a doctor and they never put their hands on your knee, find another doctor, in my opinion. I think a physical exam is so important, and it often finds things that an MRI won't, because again, MRIs are not perfect. And then they're going to order the proper diagnostic studies. They're not just going to right away say, oh yeah, you need an MRI, goodbye. Maybe just an X-ray. X-rays can pick up most of the diagnoses in orthopedics as well. And then another thing to look at is how are they going to treat you? So if you have a pain in your knee and they say, oh, I think it's a plica, which is a little band that some people are born with and can become irritated, and they say, yeah, let's just cut it out. We'll do surgery next week. Run away. Blame somebody else. Because there's a lot of things that can be and should be treated without surgery. Just because you're seeing an orthopedic surgeon doesn't automatically mean that you should be signing up for surgery. Certainly there's certain things that should be operated on, absolutely, but there's many things that should not be operated on until you try a course of conservative measures first. I'm a huge physical therapy advocate. I'd say 95% of my patients end up going to a therapist whether they need surgery or not. And so many patients can get better without surgery. That's another thing to really look for. Somebody, an orthopedic surgeon who is not all about doing surgery, but also interested in seeing if they can get the patient treated without surgery. Because, you know, even though surgeries are relatively low risk, there's still a risk. So if you can avoid surgery, it's better.
That I'm surprised to hear from a surgeon. So
I know.
That's great. Okay, so what makes your practice stand out from other practices maybe in the area?
Well, I think one of the things, first of all, I have to say, I have to give credit to my staff. My staff is amazing. You come into the office, the minute you meet the person at the front desk, to my nurse, to my MA, to my physician assistant, to me, to X-ray tech, everybody is so involved and interested in the patient. You're not just a number. Everybody cares. Everybody's going to say, hey, how's your family? How's school? How's whatever? How are you feeling? How are you dealing with this injury? We really do care about our patients, all of us. And I think that's a little unique. In fact, some of my staff, including myself, you know, we sometimes even make house calls. For instance, I live in a ski area, and let's say I fix somebody's broken leg one night, and a couple days later I need to see them back. But there's a snowstorm. They're visiting. They don't have a car. We don't have a taxi service in Crested Butte. So I'll just say, you know what, I'll just come to your hotel or their condo, and I'll make a house call, which is kind of fun, actually. I'll bring my kids, and they make them hot chocolate and give them cookies, and my kids love that. And it's really something. The patients can't believe it that a doctor actually makes house calls anymore. And to be honest, it's not that difficult. It's certainly easier for me to swing up there after work than them try to find a way in a snowstorm to get to me. So we just really care about our patients, and it really shows, and I think that's unique. Another thing is, like I was alluding to earlier, I really believe in conservative care when it's proper, when it's possible. If somebody has a clear-cut need for surgery, I'll be the first one to recommend it. But there's so many diagnoses and entities that can be treated conservatively, and I always think it's good to try that. So I've been traveling with the U.S. Olympic Committee to many different Olympics and international games for about 13 years, and through my travels I have picked up so many techniques and ideas from around the world, from different doctors that I always try to interact with when I go on these trips. And I have developed some amazing tools here that a lot of other doctors don't know about even. So for instance, there is a technique that I started using about 2 years ago, and it's where you use ultrasound. I got really interested in ultrasound about 4 years ago, diagnostic ultrasound, when I was at one of these international competitions. And I was so excited about the ability to diagnose so many different things with ultrasound that the minute I got home, I bought an ultrasound machine and I started studying very hard and practicing very hard, and I've been using it now for about 4 years. And it's literally changed my practice. So for instance, someone comes in with shoulder pain and I suspect a rotator cuff tear, which is a tear of a very important tendon in the shoulder. Instead of ordering a very expensive MRI, getting it authorized by the insurance, having the patient schedule it, get it done, come back for another appointment. You know, it could be a week or two ordeal for the patient to find out if they have a rotator cuff tear. Well, now I take my ultrasound machine in the office, put it on their shoulder. Within 5 minutes, I have a diagnosis. Yes, you have a rotator cuff tear. Or no, you don't have a rotator cuff tear. It's incredible. I mean, it has really changed my practice, and my patients love it. Number one, it's a lot cheaper than an MRI. Number two, it's live. The patient looks at it with me, and they can understand the anatomy and the pathology. And that's another important thing I'll get to is education. It's so important. But anyways, so I learned ultrasound. I'm very excited about it. And 2 years ago, I learned about this technique where under ultrasound guidance, you use this ultrasonic probe, and through a tiny little incision under local anesthesia, you can go into a chronic tennis elbow or a plantar fasciitis or an Achilles tendonitis or a tendonitis in the knee that has been treated and not getting better with therapy and whatever. You go in and you take out with this little ultrasonic probe little tiny area that's causing the pain. You just remove it. It's kind of like phaco for cataract surgery that ophthalmologists do. And you remove the tissue and they get better. It's remarkable. And I think I have saved in the last 2 years at least 30 people, if not more, from having a big surgery. And it makes me so happy. It makes me so happy to, you know, avoid a surgery for people. And a lot of surgeons may not feel that way. They're like, oh, let's just do surgery. No, if this works, if you can do a tiny, minimally invasive procedure and avoid the patient's need for anesthesia and a big incision and a risk of infection and a risk of blood clot, et cetera, et cetera, et cetera, it makes complete sense. So I think that makes my practice different from many practices. Is we're really always looking for a way out from surgery for many different things. Because again, surgery, yeah, I'm a surgeon. Surgery's fun. It's exciting. It works most of the time. But if there's an alternative, I'm all about it.
That is really refreshing and very amazing. And it's got to be a lot of fun for you to, you know, put another one on the board that you didn't have to do surgery for. I think that's amazing. That's great.
I had an Olympic pole vaulter. This is 2 years ago, and he had been suffering with patellar tendonitis for 2 years. And I met him in London at the Olympics, and there was all, you know, he had some muscular imbalances. I said, okay, we need to treat this, we need to do that. And he wasn't getting better after a year. We did all this aggressive therapy and treatment. So he was going to come back to my center, and we were going to do an open surgery to remove the scar tissue, a big open surgery. And right before he came to town, I learned about this new technique. And I said, you know what, let's just try it. It burns no bridges. If it works, we saved you a surgery. If it doesn't work, okay, we'll do the surgery in a couple months. It worked. He was one of my first patients, and he's 2 years out, no pain since the day we did that procedure. Now, he had to rehab it for a couple months. You gotta let it heal. Yeah. But it was amazing. So I'm a big proponent of these alternative methods. And here's another thing that you might not believe as a Western-trained doctor, but I have found a lot of patients respond to acupuncture for many different entities. So I have an acupuncturist in town who I just love, and I have her involved in post-operative or non-operative treatment for many of my patients. And I don't think acupuncture all by itself does the trick. I think it's a good adjunctive treatment protocol along with other things. So if I have somebody with a chronic problem or a stiff joint, for instance, I send them to therapy, and I also send them to acupuncture because theoretically it enhances blood flow and it helps things heal. So I'm a big advocate for that type of alternative medicine as well, which, you know, some of my colleagues think I'm crazy, but I see the results. So, you know, you can't argue with good results.
Well, and there you go again. It's such a non-invasive procedure when they go to an acupuncturist. So that's great too. Good, you're thinking outside the box. Okay,
Yeah.
so if say someone, you know, has an accident up on the slopes or that type of thing, and they come down and they find you, what kind of experience would you expect that they would have? What does that look like in your office?
Well, again, like I mentioned earlier, my staff, they're all very warm, loving type people, and they really care about the patients. So they'll come in, and you know, a lot of times, not only the patient, but the family members. Let's say it's you know, a 17-year-old, and the mom and dad come in, and everybody's scared. And so the first thing we do is we try to reassure everybody. It's going to be okay. We're going to take a look at this. You know, they'll say, Dr. Beim will be in shortly. They take their vital signs. They make sure everything, you know, they're safe and stable. And then I'll come in and I'll talk to them. And again, face to face, eye to eye, that's very important. Listen, what happened? How did it happen? Did you ever have problems before? You know, history is very important. And then, you know, we'll do a physical exam, and we'll certainly not just go in and start, you know, messing around with the knee or the shoulder or whatever is injured, but very gently and calmly we'll do a physical exam to try to figure out what's wrong. And then we'll get x-rays. We have x-rays in our office, or I'll do an ultrasound in the office if I need to try to figure out what's going on. And then, you know, we'll do the proper treatment. But I think that the thing, again, that stands apart from other practices perhaps is just the empathy and the caring of my staff. So people come in and they really feel like we care. They're not a number. You know, it's like, oh, all right, you have this, yeah, well, you know, you need this surgery, you need that, and my staff will set it up for you. No, you sit down, you hold their hand, you let them know it's going to be okay. Because, you know, let's say somebody tore an ACL, which is a big ligament in the knee that many skiers injure, and football players and soccer players too. But it's a big deal because if you want to continue your sport, you do need surgery for that. And you need a lot of recovery. It's about 6 to 8 months before you can get back to your sport after an ACL reconstruction. So that's pretty big deal to lay on somebody. You know, they're out skiing, having fun, and now you say you can't ski for 8 months. That's big deal. So you have to really understand, and I can really understand it and relate to that because I've had, I think, I've lost count, 9 surgeries on my knee since I was a kid. And I was an athlete always, and I really understand what it's like to not be able to do your sport and have to do the physical therapy, which can be very difficult sometimes. And I really understand that, and I'll share that with the patient. I'll share sometimes my experiences and say, listen, I get it. I've been there, and I understand, and you're gonna get through this, and I know you can, and it's gonna make you stronger, and it's gonna make you better. You know, for me, my injuries and surgeries made me become an orthopedic surgeon. So I look back and I'm almost glad I got hurt because who knows where I would have been otherwise. So, you know, I'm a big believer in trying to make every bad situation positive. How can we make, you know, have a glass half full? How can we make a situation in a positive light? Yes, you injured your knee, but you didn't injure your head. You know, you're going to be okay. You're going to recover from this and be better than ever. So I think that's important to really understand patients and spend the time with them and make them understand that you care and that you're going to help them every step of the way to get back to their sport.
Well, you know what I think is nice is that when they walk out the door, they're not going to have a million questions because you will have answered them by then. And that's huge because especially if they're travelers and they're, you know, in just for a ski trip, you know, they've got a lot of questions. So I love that about your practice, that they do, you answer those questions and, make them feel like they can recover from this. So I think that's wonderful.
It's important. And another thing, as far as looking for the right surgeon, I think it's really important because we are in a ski area or a resort area, and there are a lot of travelers. And if somebody, for instance, tears an ACL, I've got friends all over the country who've had great sports medicine fellowships. They do a great job, as good as I can, doing ACL reconstruction. Once you've had the proper training and done a couple hundred, it's pretty much not so difficult. I think it's really important to make the patient understand timing. So there are some practices or surgeons who might say, oh, I'll just fix you tomorrow before you go home. And that might be important for certain entities that really need to be stabilized before they get in a car or a plane home. There's no question. An unstable tibia fracture, ankle fracture, unstable wrist fracture, whatever. But there's certain things that are not emergency surgeries. And actually, not only is it better for the patient just to put them in a knee brace, crutches, ice, send them home, and have their doctor at home do their surgery, because follow-up is important. And I always tell people that the surgery is 10% of the success. The rehab is 90% of the success. And to have a really successful rehabilitation program, I think it's important that the surgeon is involved in every step of it. Well, if I do their surgery here, which was not an emergency, they could have gone home. If I did that, then the doctor back home maybe does things different than I do and doesn't really understand what I did as much. And it would be more difficult for them to monitor the rehab process. So I usually tell patients, look, I'd love to fix you, but I think you have a better result if you go home. I'll give you the name of a great guy in your town and have the surgery there. And I don't think that happens that often, unfortunately. And I think that's really important. Now, again, unstable fracture or an injury that could cause neurovascular compromise, injury to the nerves or vessels. I'm doing emergency surgeries all the time in the winter, for instance, for stuff like that. But if it's not an emergency, and to get on that ACL subject again, because it's so common, a skier falls, twists the knee, tears the ACL, I wouldn't even do the surgery the next day if they begged me to, because the literature has shown you've got to rehab that first. You got to get rid of the swelling. You got to get your motion back. You got to get your quad firing before you do the surgery. If not, you have a high risk of a complication called arthrofibrosis, which is scarring. That's a whole other subject. But my point is, there are certain things that should not be operated on right away. And just to do the surgery while they're in town before they leave, I don't think that's right. I think the patient should be stabilized. And if they can go home to have their surgery where they live, I think it's better for the patient. And isn't that why we're in medicine? It's to do what's best for the patient. So that's another thing I would have people, if they go ski somewhere and God forbid they get injured, ask the doctor, do I really need the surgery today? Can I get a splint and do it at home? There's nothing wrong with that for many entities. If they say, no, if you don't do your surgery, you're going to get a compartment syndrome and you're going to lose your leg. Well, clearly, you should have surgery there. But it's not a bad question to ask. Is this something that could be done back home? If they say yes, go home. If they say no, you got to have some trust in your doctor.
Well, that tip right there is $1 million tip. I mean, to know that you can actually ask, can I do this at my, at home? Does this have to be done immediately? Because most people, they wouldn't ask that. And maybe,
right.
Maybe the doctor would tell them that anyway and maybe not. But if they ask it, they might get the answer that yes, we'll stabilize it. You go home and have it done there.
Yeah.
So
it's worth asking. And, if the doctor says no for these reasons, then do the surgery. But it's not a bad question to ask. Another example, you tear the ligament in your thumb when some people, when they ski, it's called a skier's thumb. That's not an emergency. You can fix that within, a week to 10 days easily. Put them in a cast or a splint, send them home. Mm-hmm. That's my philosophy. I'm not saying I'm right or wrong. That's just my philosophy.
Sure, sure, but I can see where that would appeal to a lot of people.
Yeah.
That if they could get back in their own home and maybe the trip is over, but if they could get back in their own surroundings, there's a certain comfort level there also. So.
Yes, and also it makes it easier for the family.
Yeah, that's what I'm thinking. They have to sit here during the whole recovery. Maybe
Yeah.
that could be a real hardship.
That can be difficult. Yeah. Yeah.
Okay, great. All right. Well, I think you have really given some great information. I appreciate that you came on to do this because I think that there'll be a lot of people that will benefit from this. So, all right. Well, I think we've covered it now. I'm going to go ahead and sign off here. This is Terri from HM Local TV, where we find great companies and introduce them to the world. Dr. Beim, thank you so much for being here.
It's my pleasure. It was fun. Thank you.
All right. Bye.
Bye-bye.